Hello everyone, and welcome to another Arthritis Help movement improvement session where you learn to move differently so you can feel better. I'm Dr. David Sofer, physical therapist, and today we're going to be talking about engaging and working those abdominals. Yes, we're going to work on that washboard. You might not have seen it in a while, but I promise you it's in there, and we're going to engage it today and let you get to know about all of your abdominal muscles. There are actually three main groups of the abdominal muscles. You have your rectus abdominis, which are kind of like those big power washboard muscles. Your transverse abdominis, which is kind of a corset. It's like a back brace, and when it's engaged, it can really help to reduce low back pain and low back stresses. And then the obliques, the ones that let you go from side to side and do a little bit of twisting. We're going to engage all three of those today, get everything nice and primed so that way when you're moving around, those muscles are ready and willing and able to work for you. So for today's session, it's going to be done completely lying on your back. No special equipment is needed, only an active mind and an energetic enthusiasm and maybe a pillow for a little bit of comfort. So lie down on your back and let's get started. Okay, so we're just going to start lying on the back, and we're just going to take a moment just to breathe easy, sink in, find a comfortable position. You want to make sure that you are completely comfortable here, okay? Never put yourself in pain. Rule number one, always be kind to yourself. So if you need a little pillow underneath your knees or an extra pillow for your head, take this time now to figure out what is the best way that you can feel supported and comfortable and easily kind of conforming to the surface. Great. Okay, from here, we're just going to take a moment and we're going to put the hands on the belly, and I want you to, you're actually going to stop breathing for a moment. You're going to hold your breath, and you're going to blow your belly out, but without breathing. So you're going to stop the breath and just blow the belly out a couple of times, just like that, but not by breathing in or breathing out. Just using your muscles and your diaphragm to kind of push your belly out. Good. And relax. And that might be tricky for some of you if you haven't done that before. And so if it is, you can take time to practice it. And now we're going to do the opposite. So we're going to stop breathing again, and we're going to see if we can draw the belly in, but not through breath, not by sucking in, but by stopping the breath and just drawing the belly button down to the spine. Just like that. Good. And getting a sense, if you can have that control where you can blow your belly out or pull your belly back without having to change your breath. I can do it right here and I can still speak because it's independent of my respiratory muscles. And that can be a tricky coordination to get sometime. Even that is just an interesting exercise. I could probably do a whole session with that. But I want you to see if you can find that control and ability to be able to blow out the belly or draw the belly back down without controlling, without affecting your breath, or without having to breathe at all even. Very good. So we're going to focus for this one more on the drawing down than the blowing out. And I want you to just think about that drawing down. And when you draw down, it's kind of like pulling the belly button into the spine, or like if you're trying to zip up a tight pair of jeans, sometimes that's when we engage these muscles. And I want you to feel how it kind of, when you do that, it kind of opens up the front of the hips, and it might draw the low back down into the table a little bit, or into the surface. Good. And it's very subtle, so if you feel it, great. If you don't feel it, no big deal. It really depends on a lot of factors, but that is happening if you can draw the belly button down. It's lengthening the front of the hips, and it's drawing the back down a little bit. Very nice. Okay, we're going to forget about that for a moment, and we're just going to bend the knees comfortably, standing your feet, and all we're going to do is rock the pelvis back and then let it rock forward a little bit. And these nice pelvic rocks we've done through a whole bunch of other times and a bunch of other sessions. I want you to rest your fingertips right on the pointy part of your hip bones. For me, they're kind of connected right on my belt line, and so I want you to just get this feel that that is rocking back or looking up towards the nose, and then it relaxes and it kind of tips forward, and just get this feeling of freeing the pelvis and moving that pelvis back and forth. Good. And this doesn't work a lot of abdominal muscles. You can use a lot of other muscles to do this, but I just want to get this feeling of rocking the pelvic back and forward to free it up so that way when we do need to use the abdominal muscles to move it, we have this comfortable freedom and fluidity to move through. If it feels stiff just doing this, it's going to be very difficult to engage the abdomen to control the pelvis. Okay, this nice easy rock back and forth. Good, and if you're feeling comfortable with that, we can relax, and we're going to straighten out the legs. And then we're just going to go from here. Now, without the knees bent, you can't use the leg muscles to rock the pelvis back, so you have to use the abdominal muscles. So from this position, what I want you to think about is we're going to draw that belly button in, and we're going to rock that pelvis back and feel the ribs drop down and feel the belly crunch. Now you're going to feel those rectus abdominis muscles, those washboard muscles working, and then relax. And for this exercise, if your hands are large enough and you can find them, that I want you to have fingertips on the pelvis, right? And then also thumb, if you can, on the ribs. And you're going to feel that when you draw the belly button back and roll the pelvis back, that they come into each other. You can even use your hands a little bit to kind of squeeze a little bit, so that way it just kind of guides the body down. And that lets you know that you're moving from the bottom up, so using those lower abdominals to roll the pelvis back and those upper abdominals to drop the pelvis forward. Good. And relax. We're just going to do a few of those and get this idea of the ability to control and move the pelvis through the abdominal muscles which connect at the ribs and at the pelvis. What you shouldn't be doing is there shouldn't be cheek squeezing. Sometimes people like to do cheek squeezes. That's a fun exercise for another time, but not included in this, okay? So you want to feel that ability to draw the belly button down. That's your transverse abdominis, and then roll the pelvis down and the ribs down, roll the pelvis up and back rather, and the ribs down, and that's your rectus abdominis. Those are the washboards. And relax. Good. So let's just do a couple more of those. Draw the belly button in and then roll the pelvis and then let it all go. And relax, and make sure you fully relax between each one. Always want to disengage so then we can practice engagement. Draw the belly button back, roll the pelvis back, depress the ribs. Good. And then let it all release. You should feel that the low back, the lowest part of your back, really sticks to the floor when you engage, and then when you release, it starts to let go of the floor a little bit. Great. Perfect. If you can do that, that's tremendous, because that really means that you have nice control and nice engagement through the abdomen. If you can't do that, that's a great exercise to practice just on its own. It helps you to just find those belly muscles and get really refined with controlling them. So now what we're going to do is we're going to use those muscles to draw the heel back into a heel slide. So we're going to do that same movement of drawing the belly button down and rolling the pelvis back in a way that helps you to slide your heel and bend your right knee. And then I want you to re-engage it at the top and then use that contraction to control the descent down, and not until the leg is all the way down do we release. So we're going to engage the belly, roll the pelvis and the ribs, and feel how that helps to pull the knee up. And then we still want to hold that. We don't just release when we go down like gravity do it. We want to control. So we hold that strong belly, and then we release. And as we get straighter and straighter, it's a little harder to hold the belly. And then when that leg is fully down, we relax and we unweight things. Let's try a few of those. Draw the belly button in, roll the pelvis back, feel that heel slide back, and then you can re-engage and then keep that engagement as you straighten out. And then when the leg is down, you release and you feel everything rise again. You should really feel, if you don't engage the belly, I like doing the wrong way. I like doing opposites. So if you don't engage the belly and you lift the leg, you'll feel that your back wants to rise and that your leg feels a little bit heavy. But once we engage by drawing the belly button down and rolling back, that knee sort of floats. It's a lot lighter to lift. It just puts the body in a position where it's easier to lift and the back sticks down to the floor, and then release and relax. Good. Let's go over to the other side and see what the other leg does. Sometimes it's a little trickier one side over the other, so let's try the same thing. The setup is exactly the same. We draw the belly button in, we roll the pelvis back. We use that to draw that knee up. We're doing the left knee now, and then we engage, stick that back down to the floor, slowly straighten out. Really think about that end part of the straightening. Don't just collapse. Lower yourself down, and then release the pelvis. and then re-engage the pelvis and feel how it just draws that knee up and it sticks the back down, and then re-engage. And even though I have no pain and not too much difficulty here, I can feel that my left side just doesn't work as well as my right side. If you've watched any of my other videos, that's a theme for me. I'm constantly trying to figure out this left side, and that's okay. Don't need to be perfect, just practicing and improving. And straighten out and relax. Good. Draw the belly button in, roll the pelvis back, feel that pelvis and ribs come together, approximate each other, and that leads us into the lift. And then hold that engagement as you straighten out and keep it till the end. And then when your leg rests, you let it go. Let's just do one more. Roll the pelvis and engage the belly as we roll back. Very nice. And then let it straighten out, keeping the back flat as long as you can, and relax and release. Beautiful. Okay, if that is comfortable and you're feeling good with that, we're gonna do the next progression. This is a little bit trickier, maybe a lot trickier. So if that was hard for you or painful for you, just stick with that one. But we're gonna try this. We're gonna do it, and we're gonna try to slide both heels back at the same time. So we're going to engage the belly, we're going to roll that pelvis back to the ribs, and we're going to feel that as we do it, it makes both knees float as we bring the knees back and release. And then we're going to stick the back down into the table, into the floor, feel the ribs come down, feel the pelvis, and then straighten slowly, and don't release until the legs are fully weighted on the surface. Whew, let's try that again. Okay, we're gonna breathe out, feel the belly draw down. Good, let that bring the heels up, and then hold as you straighten and bring the knees down, and then release. That's your nice breath in. On your next breath out, draw the belly button down, roll the pelvis back, engage and slide up. Good, feel that low back stick to the floor and stay stuck to the floor even as you straighten out, really focusing to not collapse. Keep that control all the way through if you can, and then release. If you can't, it's okay. Or if you have to put a pillow underneath your knees and that's your end point, that's okay. Do what works for you. Just work on getting a little bit refined, a little bit better each time. Let's do maybe 3 more here. Breathe out, engage the belly, roll the pelvis, tighten up those belly muscles. Good, feel the legs float up. And then hold and come down. And then again, roll and pull them in. Good, and it should start to feel like one continuous movement. Or it should start to feel like instead of doing 5 things, do this, that one movement leads into the next, which leads into the next, and you find this flow. And when you can find that, everything works a lot more beautifully and efficiently. That's what we're always searching for, is that kind of flowy feeling. If you don't engage the belly at all and you don't do anything and you just try to pull the heels back, you're going to feel that your back's going to want to pop up. It's going to arch. It might even hurt your back a little bit, and the legs just feel so much heavier than if we roll and engage and they get lighter. That's what we're searching for. Good. And come down, relax. Whew. Give yourself just a second to relax and let the belly muscles rest for a moment. Okay, that was fantastic. The next thing we're going to do is we're going to actually bend one knee. Okay, and now we're going to use the belly muscles the same exact way to roll and engage, and this time give a little bit of a leg lift and then bring it back down. Make sure the opposite knee is bent. That will help you to roll the pelvis back and help you to flatten the back down, and it'll protect the back and prevent you from kind of arching and feeling potentially pain in the back. So we're going to breathe out, draw the belly button down, roll the pelvis back, flatten the back, and feel at the very end the foot just pops up. It just kind of floats, and then we hold that engagement as we come down and release. Roll back, flatten the back, lift the leg, let that movement flow into it, and come down and release. And breathe out, engage the belly button, flatten the back and lift, and then come all the way down and then release. And if you're not sure you're getting the feeling, do a bad one. Don't engage, do everything opposite and feel how heavy and how hard and how uncomfortable it is to lift. And then do it all the way that I described and let everything roll back, and let that roll back flow into the lift and then down and release. Let's do 3 more. Roll back, flatten the back, lift, and lower down. If you need to rest, rest on your own time. You're not required to keep up with me. You're not required to be bound by me. If I'm doing it a little bit and you want to do more, you can continue to do that, however it works for you. And relax. Beautiful. All right, we're going to bend that knee and then straighten the other, and we're going to even it out on the other leg and see what the other leg feels like. We're going to breathe out, draw the belly button down, flatten the back down, feel those ribs and pelvis, good, and come back. And this whole time I've kept my thumb on my ribs and my fingertips on my pelvis, and it just helps me feel that nice guidance of everything kind of crunching down in order to help support that leg lift. So we draw it back, and I feel this ability to draw it down as the leg comes up. We don't need to come all the way up. Coming up high doesn't serve us. And then come on down. Good, we just need to get that littlest lift. We need to think about how to use the belly to actually just get off of the floor and then come back down. Once you're off, pretty much the work is done. Everything else is a little easier from there. So let's do a few more, good. 3 more, we're gonna breathe out, feel the belly button draw down, flatten the back, lift the leg. Good, 2 more. And you'll feel that as you do this, you need to use your hip flexors less and you can use your belly more. And those overused hip flexors can kind of get a rest. If the back is arched and we lift, the hip flexors have to do all the work. And they're so used to taking that burden that being able to use the abdominals actually gives those hip flexor and low back muscles a nice rest so they don't have to work so hard. Good. And relax and release. Good. Take a moment, just lie flat. And just get a sense of how you connect to the table. You might feel that the curvature in your low back is a little bit more subdued. Maybe some tension that was in your back is a little softer. Maybe not as pokey through the ribs, that you're able to find flat a little more comfortably. Or maybe you don't need a bolster behind your knees anymore. The knees lie a little flatter. Often that happens after we do this nice abdominal engagement. Okay, we got 1 more. I promised we were going to use the obliques. We're doing the oblique exercise now, so we're going to bend both knees. You're going to let your knees fall off to the side, and when you do, that's going to naturally lift your low back. Now, I want you to have the knees to return, but I don't want you to think about bringing the knees back. I want you to think about taking the back, the part of the back that's lifted, and that belly button, and drawing the belly button down into the part of the back that lifted, and put the back down onto the floor, and feel how that brings the knees back up. And then I want you to hold that part of the back down as the knees come over and feel that you release the back from the floor in order to lower the knees. So you are controlling, you're not letting gravity push you around, right? You're controlling the weight of your legs. So whatever lifts, we draw it down from the top, from up here, we draw it down, and then from here, and then from here, and then from here to flatten ourselves onto the table or onto the floor. And then we hold it down as the knees come over. We just release a little bit and release a little bit and release a little bit in order to find our way up. Good. So really feel that you're taking the ribs that are twisting and you're flattening those ribs down, pulling them down. So it's not about, don't even think about lifting the knees. The knees coming up is just a happy accident. It's just a byproduct. And then the knees fall over and they're dragging you out, but you are not letting them pull you. You are slowly releasing that abdominal contraction. Let's do 3 more, flattening that back down to lift the knees, and then letting the knees come over and letting it lift you up. Good. Feel the ribs, feel the torso. Start from the highest point that you can and then move to the lowest point. Good. And bring it back down. If there's any pain with that, just don't go so far. So you're in control. You don't have to be all the way over. You can go just a little bit and then return. And if for you, if it's just this little movement here and then returning back, that is fine, because it's not so much about how you do it or the intensity that you do it. It's learning how to move, right? It's not about how far, it's not about how much, it's about how. And so even if we do a little bit, but we return in a way that's controlled and comfortable, that's gonna really pay off in spades. All right, so we're gonna come back the other direction. Feel how the back pops up when we go this way, and then flatten the back down and feel how when we return the back, the knees naturally find their way to upright. And then we hold the back down, we allow the knees to fall, and then slowly we release the back by releasing that abdominal contraction. And then we could even use the breath out here. We breathe out. We feel how that brings the belly button back to the spine. And then as we come down, you can let that breath in. That lets the legs hang a little further, but it's that breath out that really helps to find all of those abdominal muscles and right the torso to bring the knees up. And then we bring it back down. We've got 3 more on this side. Engage, engage, engage. Feel those ribs come to the pelvis. And we can even keep that fingers on the ribs and pelvis like we did before, and we'll feel how open they get, especially on the top side. And then as we clamp it down, it helps to bring us back up. Good, one more time as we roll, and then engage to come back up and release. Beautiful. And take a moment and breathe and enjoy the fruits of all your labors here and feel the easiness of breath. Feel how easily the belly can rise and fall. See if you have a little bit better control to blow out and draw back the belly than we did before. See if it's a little bit easier to flatten the back down than it was before. See if just laying here doing nothing, if you feel a little bit more connected to the surface, if you feel a little bit more elongated through your body. Excellent. You can continue doing that for as long as you want, or you can come and sit up with me, and we're gonna come to a nice seated position or a standing position if that's more comfortable for you. And we're just gonna take a moment and feel what engaging the abdomen, how it makes us feel stronger and more solid and more upright and maybe more resilient to those downward forces of gravity that are always acting upon us. Thank you so much for joining me this week, and don't forget to thank yourself for taking the time and making the effort to do things that are good for you and that are going to improve your health. It is not easy. Not everyone does it, but you did. So give yourself a little pat on the back today. You deserve it. I will be back next week with a whole new video series teaching you how to move differently so you can feel better. You can see my whole video library on www.arthritishelp.info, somewhere here on the screen. Okay? I'll see you all next week. Take care.